Hi and welcome to Pharmacy Skills. This is the BNF introduction, and in this lecture video we are looking at the preface. So who wrote the BNF? Now, that's a good question. It's not so much a person, but it's more a group of people. The BMA is one of those groups, which stands for the British Medical Association. These are a trade union for doctors in the UK. Now, this is not to be confused with the GMC, who are the General Medical Council, who are responsible for certifying doctors. The BMA, instead, they support doctors through things like training and career. Now, the other group which is involved in the publication of the BNF is, as you would expect, the Royal Pharmaceutical Society. The Royal Pharmaceutical Society, RPS. The two groups get together and form a joint committee, and that's not to say that other professional bodies are not involved. For example, you get the British Dental Association, who oversee advice on drug management of dental and oral conditions. You also have members of the Nurse Prescribers Advisory Group there to offer advice relevant to nurses. So in short, it's a collaborative effort between a number of professionals, and so it needs to be, really, seeing as it's the standard for health management advice across several medical professions here in the UK, and everything in it has to be based on evidence and not just strong feelings. I remember someone remarking once that when it comes to medical care, we really don't care about your feelings, just give us the facts, just as in tongue in cheek. Now, the BNF, as big as you might think it is actually not exhaustive or extensive. It's actually quite light in detail in some areas like obstetrics, malignant disease, and anesthesia, since you're expected as an expert in those fields to have expert knowledge through journals, publications, and keeping up to date with that kind of thing. Therefore, it is really up to health professions, I guess in any field, to use professional judgment and their understanding and training to inform their decisions. You know, when it comes to making decisions, it's not good enough just to say the BNF made me do it. If you're a healthcare professional, you must always exercise professional judgment. Most people don't know that the BNF is updated twice a year. I know it seems like a lot, but it is important to stay up to date with current guidelines and to keep up to date with changes as science keeps on going forward and discovering new things, and trials and medication is changing all the time. So the BNF publishes a list of changes just at the front, in case you wanted to look at that yourself. There's a quick summary on changes each time a new publication comes, so if you're familiar with a previous publication, you really don't have to go through the whole thing looking for changes. And in fact, you can find a list of changes online. And to make things nice and handy, you can just go online and find the list of published changes. And by the way, if you're one of those quote unquote millennials and you're looking for apps and things you can do to make things easy for yourself, head over to bnf.org. And don't ask me how to spell that. And there you'll find a list of apps and publications and publication formats that might actually pique your interest. So when you open up the BNF, what do you have? Well, it starts with a preface, and for those of you that don't know what that is, it's just an introduction to a book. You find it in most books. The preface tells you here in the BNF its subject matter, its intentions, and then they have acknowledgements. I know no one really needs the acknowledgements, but I guess it's important for record keeping and for book writing to have them down. But trust me, they won't be coming up in your exam as a student. However, if they do come up, remember the name MN Badminton. This is just one name that stuck out to me as I was going through the acknowledgements in the BNF, looking at the contributions made. I just thought it was a cool name. Anyway, the BNF also has a lot on pharmacy law, which you normally find in the MAP. They've included things like emergency supply, controlled drugs, prescription writing, and so on. It gives general guidance to prescribers in prescribing high-risk patients as well. Now, high-risk patients generally need to make some kind of dose adjustments, and this includes extremes of age, pregnancy, and breastfeeding, palliative care, and so on. The BNF has, I guess in total, you're looking at 16 chapters, including various systems and specialist medications, which we'll definitely be diving into for your enjoyment. And now, beyond the 16 chapters, there's quite very extensive appendices, not to scare you away, but like this is something that we need to cover in detail as well. Very relevant to your exam. I know normally some books, appendices is something you normally can skip and be all right, but no, not at all when it comes to the BNF. Well, anyway, with that said, in the next chapter, we will look at how to use the BNF. Adios.